everyone, my name is Olivia. I'm a physiotherapist here at Vital Core Physiotherapy, and today I'd like to talk to you about pregnancy pelvic girdle pain. Now, pregnancy pelvic girdle pain is exactly what the name suggests it is. It's pain in the pelvis area during pregnancy. It can be anywhere in the pelvis area, but most moms experience pain around the sacroiliac joints, which is in the back of the pelvis, or in the pubic area in the front of the pelvis. Now, this pain greatly impacts activity, for instance, getting up from sitting, getting out of the car, going up and down stairs, or turning in bed, and just getting comfortable in bed can be really tricky as well. So, I'd like to give you a few tips on how you can self-manage pregnancy pelvic girdle pain. First of all, for pain relief, you can use either ice or heat, whichever works best for you. Most mums find ice really helpful around the pubic area, and you can use any ice pack or bag of peas, whatever you've got on hand, and apply that over the pubic area for about 10 minutes at a time. Similarly, you can use heat in the form of a wheat bag or a hot water bottle and apply that over the sacroiliac joints, and most mums find the heat helpful over there, but you could also use ice if you prefer that. Another useful way to get rid of the pain with activity is to use continuous heat. So you can use heat patches, and you can apply that over a layer of clothes, and you'll get that slow release of heat over 8 to 12 hours. Pelvis support belts are also really useful, especially if you're on your feet a lot, but we're going to talk about that in a different video. Next tip is maintaining a good posture. We don't want to be in that exaggerated pregnancy posture where the shoulders are behind the hips with the belly out in the front. So what I'd like to encourage you to do is just to check in with your postures throughout the day and just make sure that the shoulders are stacked over the hips. Now, I don't want you to be all stiff and rigid when you move, but just regularly checking in with your posture can be really helpful for your pelvis. If you have pain at night and struggling to get comfortable in bed, what I'd like to suggest you try is a pillow between the knees. And you may have heard of using a pillow between your knees before, but it can't just be a flat pillow. You need to use a nice, bulky, big pillow that really keeps the knees well apart. And then to turn over in bed, try going onto your hands and knees to turn over instead of swinging your leg over to turn. Some stretches can be really helpful to relieve the gripping and stiffness around the pelvis area. One really useful stretch is the piriformis stretch or the gluteal stretch, where you cross one foot over the opposite knee and slightly lean forward in a sitting position, and that'll just really give you a good stretch through the buttocks area. But we don't want to just stop with stretching. We know that the muscles can be stiff and weak, so we really want to then move on to strengthening those muscles. And something as simple as a squat can help build the gluteal muscle strength, which will then help improve the support around the pelvis. But an individual program is still going to be best. So if you're having pain in the pelvis area, please get in touch with one of our experienced physios here at Vital Core Physiotherapy, and we'll set you up with the individualized program. So that is it from me for today, but if you have any further questions, please get in touch with us at Vital Core Physiotherapy. Goodbye.